All right. So now to hear from both an administrator and a survivor. So thank you, Dr. Horn.
Well, thank you very much for letting me participate in this amazing conference. Yes, professionally, I share a common goal with many of you in the room. I'm a registered nurse over 40 years and a hospital CEO for about half of that time. But unique, possibly, is the fact that I've had my personal journey with cancer twice. My mother died of cancer, my middle sister died of cancer, and my oldest sister has survived breast cancer as well twice. I'd like to underscore for you, just to sort of reinforce the things that you're doing. The hardest thing is when you sit in limbo. If you can reduce that early time period at the front end, that's the greatest gift you can give back to your patients. Because I can tell you, worst case scenario is the area that you're always going to focus on. So when you take something that you've measured and it's been 14 days and you can decrease that to 7 days, and even better yet, decrease that to 4 days, keep going, because that's amazing. And that's one of the most powerful things you can give back to your patients. And here's another reason why that's so powerful. As this physician here in front of me shared with you yesterday, we have to get the right comprehensive plan for each patient. And we can't begin to get there, and we certainly don't want the fastest plan, right? We want the right comprehensive plan, and it starts with that first step. And then once you get that plan, things certainly are a lot easier for you. To quote Dr. Harold Friedman, no patient should spend more time fighting the healthcare system than they are fighting their disease, and yet that happens every day. It happens every day. And we've talked about the high-risk population, but I can tell you clearly, I was not in that high-risk population, and I struggled. I struggled the first time, and I struggled the second time. Well, when you think about it, how could you struggle with a diagnosis of cancer the second time? My goodness sakes, I learned it all the first time, right? Well, here was the difference. I had bilateral mastectomies, and I did not have clear margins. I'd already had my maximum dose of AC, so I couldn't have the big gun chemotherapy. When I was done with surgery and when I was done with chemotherapy, I would still have microscopic cancer in my body. Tumor board did not want to radiate the left side of the breast a second time, and were concerned about cardiac involvement. Wow. Wow, what a scary thing to hear, if you will. And again, I'm not the high-risk population. So my first time when I had breast cancer was about 13 years ago. I did not have a navigator. This time I had 3 navigators because I lived a long ways from care, but I was in an HMO. So obviously I had to stay within the HMO designated facilities. First navigator I had was in name only. Second navigator I had was barely helpful. The third navigator I had was phenomenal, phenomenal. This lady opened doors for me and broke down barriers for me that I could have never done on my own. When you're the cancer patient, there are times when you are tired. There are times when you are physically and mentally struggling, and you're not always going to be able to be your strongest advocate, even though you're trying your very best to be that. This amazing woman could get me an MRI, a PET scan, and a physician visit all in one day, knowing that my round trip from my home to care and back was 6 hours. She made that happen for me. And when the tumor board gave me results that I did not have a peace of mind about, I still didn't really know what I should do, but certainly I had to do something different than that. This amazing nurse navigator got me to a second and a third opinion over the phone. Amazing physicians who spent an hour each, 2 different phone calls, over the phone with me, had my electronic medical record in front of them. They knew my pathology. They have read my chart from start to finish, and they gave me amazing, amazing advice. And I was very blessed that they both agreed with that same strategy, and certainly I concurred. So I cannot tell you, that's that comprehensive plan, that once you identify that comprehensive plan, you can then stay the course of finishing your treatment. This last navigator I could trust. I could trust her with my life. So I can't underscore for you the work that you're doing, that it can't be a navigator in name only, that they must have competencies, that you must measure it, that they must be absolutely effective, because when they are that, they save lives. Now, I thank God for my good health today, but absolutely believe I thank Him for my amazing guardian angel. And she's actually in this room today, and she's actually been one of your presenters, and many of you may know her, but I have to call her out because it is so rare that we can thank publicly somebody who has had such a profound impact in our life and well-being. And my nurse navigator was Cindy Cantrell. Now, the other reason this nurse navigator is so important is, you know what? You're not going to want to burden your family. You know, the mother isn't going to tell her young adult sons how grave that diagnosis sound. And that woman is not going to burden her husband with how sobering that diagnosis was. You need this amazing nurse navigator every now and then to say, hey, I need a little hug over the phone, or I need to make sure that I have clear direction so I can continue to be just the strong woman that I've always been. So, sort of my message to a lot of you in this room, but more importantly, to the people that are on the Webinex, is just do it. If you will, Dr. Friedman gave us this information so many years ago, and as a nation, we are moving too slow. So just do it. If we're not really sure how we're going to fund it, just do it. There is waste in the healthcare system. I've been a CEO. Make choices. You can make choices. Fund this program. We know it pays for itself, even if we can't totally prove it. And more importantly, even if it didn't fund itself, do our patients deserve any less? If it was your wife, do you want her to have a navigator? If it was your son or daughter, do you want them to have a navigator? What if it was you yourself? Do you want a navigator? So we have great minds in this room, and continue to keep striving to make this real and vibrant and compassionate and alive across the nation. Many people watching this Webinex probably are not near as advanced as our presenters have been. So how wonderful that these slides are available, how wonderful that your names and bios and resumes are out there, and that they can continue to reach out to you and make an amazing difference. And last thing, because this is my soapbox, you heard me say yesterday, it's about treating the prognosis when we get to that time and not just the diagnosis. And I can tell you, as a caregiver especially, we struggle as an industry to do that. So find ways to do that. And I have heard us speak about palliative care, but I'm not talking about palliative care, I'm talking about hospice. And there is a difference there, a big distinctive difference. And so I challenge you as nurse navigators, and that you include, if you will, a focus, a discussion on hospice care. And then the other thing that we really haven't mentioned that I think is equally as important, if you notice, all three of your survivors sort of alluded to the fact that spiritual care is absolutely important too. So please include that. What an absolute privilege it has been to be here. I've looked at this and walked this very differently, and I just cannot begin to applaud you and compliment you for the amazing things you're doing. And healthcare is resilient. We are resilient as trained caregivers, and continue the good fight. Thank you.